Tuesday morning at Dubai Eye, Suzanne Radford visits DKC Veterinary Clinic.
I'm here to see Dr. Lucinda.
Sure.
Vet Dr. Lucinda will give her the grand tour of the facilities. First patient of the day is 14-year-old Dachshund Willy, who's here for a tooth checkup. Some might even need to be extracted.
We've got to start by checking he's healthy today, asking a few questions. We might run some bloods and do a urine test, just to check that there's no risk for the anaesthetic, or at least to minimize the risk, because as you know with anaesthetics there's always a teeny possibility things can go wrong. Don't worry though. Yeah. And he didn't eat this morning, sure?
He did not eat this morning.
Okay, good.
While a nurse prepares Willy for his anaesthetic, Dr. Lucinda starts the tour of the clinic she and her husband Todd Carson opened in February 2015.
Okay, so over here, this is what we call the fecal lab.
Okay. Fecal lab.
We don't only look at feces here. This is a microscope that we do a lot of tests on, actually. We look at blood smears, we take samples from lumps, samples from fluid, smear them, we stain them with these stains, dry them with the hairdryer and look at them under the microscope. And we also examine feces for worm eggs and parasites and things like that. So this area is kind of a more dirty area, which is why we have a sink, and that's why it's sort of tucked away on the side. This is the laboratory where we do our blood tests, and these are our in-house blood machines. So these are just desktop kind of blood tests where you can get results quickly. For other types of tests, you need to send them away to a laboratory, and those results will take longer. But it is quite nice to have quick and easy tests because you can get answers immediately for certain things. Not everything, but certain things. This is sort of the hospital part where all the work happens, and this part here is the sort of diagnostics room. We have
X-ray.
we have a digital X-ray machine here, okay, and that's where we take the pictures. We also use this for ultrasound too. This is our ultrasound machine. We put the patients, if we're scanning their stomach, they lie on this little bed on their back and you can scan them that way. And we also have a table there that we put on if we need to scan a heart, because then they have to go on their side. We start every procedure with taking bloods for pre-anaesthetic testing, just to check everything's fine, putting the catheter, and then we get them all ready and lined up for surgery, and then we do the surgeries from a certain point in time. These two actually aren't having a procedure, which is why they've got food.
They've got their food.
Yeah, we're doing some vaccinations and something else I can't quite remember. But
yes,
and they're friends, and
they're lovely,
they say,
friendly.
Get me out of here! Get me out of here!
Hello, little
Yeah,
chihuahuas.
they are cute, I have to
Giving
say.
little kisses, they are, yeah.
This area is basically a nice dedicated area where we can actually get access, right to them from where we're all working, so we can see what's going on and monitor them. There's oxygen cages there that measure the oxygen saturation,
Incredible.
humidity, yes.
Yeah.
And this here is a dental machine.
Oh.
Yeah,
This is what's going to happen to Willy later.
Yes, exactly. And I mean, it's literally, exactly, I'm sure you've seen this at your own dentist.
Yes.
Yeah, it's a scaler and a polisher. And this here is the drill if we need to do extractions or any work. And we also have, what's really cool, we have dental x-ray as well. Looks like a big old-fashioned camera.
Oh, yeah, amazing.
Yeah, but you can actually take x-rays of the teeth while you're going, and you develop them just here in this machine, and you can actually make decisions about whether teeth are okay, or once you've removed a tooth, if you've got everything, you haven't left a root behind, because that's really bad if you do that. And so, yeah, this is where all the dental stuff happens. I mean, I know a lot about this. This is what I do a lot of. So this area here is our theatre. So that's where all our sterile procedures will happen. So, your cat would be spayed here, but your dog would also have his broken leg fixed in here. This is basically the dog ward.
Oh.
So dog inpatients that either are staying here for the day, or they're not really ill. If really ill and monitored animals would be in the ICU, obviously. But these guys are all having things done to them today. Jazz over there, who's shaking and trembling, bless him. He's so sweet.
German Shepherd.
Yes, he's having
beautiful.
he's having an ultrasound of his tummy.
Okay.
So he's like, no, I'm not interested. He was begging his dad to take him home. He's like, please take me home. But he should be home in a couple of hours. So
Yeah,
it's nearly
good.
over, Jazz.
It's not too bad.
We keep track of what's going on. See, that was just a little prompt there because someone's getting admitted. So it's a list of all our animals in with pictures of them. And, depending on what goes on, these alerts come up and they actually tell you when treatments are due. And then the nurses will know they have to go and give something or do something. And they enter all treatments on an iPad.
Oh,
She's
yeah.
trying to take a picture of Willie because Willie doesn't have a photograph. So.
No, all the rest have their photo. Willie needs his photo.
Because he's adorable.
He is.
And he's got his little duck blanket. How cute. Yeah.
Yeah, you tell us all about it.
Her name is Amira.
Amira, beautiful name.
Yeah.
Yes. Hello, Willie. I know you're lovely. It's all going to be fine. You'll be home
As soon as he
soon.
gets his pre-med injection, he'll feel fine. That's the best part about a procedure, is they do get some relaxing
They can
medication.
chill out
Yes.
and relax. Yeah, lovely.
People think it's just about animals, and it's actually all about the owners as well. So it's very much a people job as well as the animal job. And sometimes that balance can be tricky because the vet's job is to be the animal's spokesperson. And it's hard sometimes. But yeah, I must say, I don't look back on my life and think that I should have done something else. So I think I'm quite fortunate.
Suzanne finishes her walk through DKC Veterinary Clinic and Dr. Lucinda turns her attention to Dachshund Willie and his teeth.
And you can see a whole lot of plaque and tartar that are on the teeth. And you can see the gums are red because there's some inflammation and gingivitis. So we start by cleaning with a scaler, a lot like exactly the same instrument that you have at the dentist when your teeth are cleaned. But obviously, animals need to be anesthetized because they can't be told to sit still like we are in the dental chair. Sometimes the cleaning can really take a long time because of this so much plaque and tartar that you actually cannot get it off. This is a little while later after we've cleaned this doggy's teeth, and you can see that all the plaque is off and you can actually see the teeth here. But this tooth here at the back, you can actually see how his root is all exposed up here because the gum's normally meant to be down here. These are all his roots and also there. We took some x-rays of that side of the mouth. This one here is his upper jaw. And he's got a big black line around this root here. And this big black area means that all the bone has gone away here, and that's why I can get the probe right through. And this part is what you could see actually away from the gum. So this tooth and this tooth with the black line and this little one at the back all need to come out. So he's finished with his dental now. He's had a lot of teeth taken out because a lot of his teeth were very badly infected. So if I open up his mouth, you can see all those dirty teeth have been taken out. And his gum has been stitched up. Same with on the top. And all these teeth are nice and white. And I think he's going to feel much better when he has healed from this procedure.
Willie slowly wakes up from the anesthetic, looking forward to being reunited with his owner and to a nice, soft meal.